Hi, welcome back to our show. Today we have a very special guest. I'm super excited to introduce you to Kensie Coyle. So Kensie, tell us a little bit about yourself, who you are.
Hi, I'm Kensie. I went to FSU. After graduating from there, I started working with Dr. Kesty. I'm her medical assistant. I've been here for about 2 years now. So I've learned a lot about lasers from Dr. Kesty in the past 2 years. And recently we've done some really cool research.
Yeah, so that's what we're going to be talking to Kensie about today. So as some of you may know, about a year ago in St. Petersburg, Florida, we had 2 hurricanes hit our community. So Kensie and I had some downtime to work on some research. And today we're going to be talking about something that we published together in the Journal of Cosmetic Dermatology. And the title is Cosmetic Lasers in the United States. Who's using them? What about the latest technology and what patients need to know? So Kensie, tell us a little bit about this research, why it was published, and how we went about conducting the research.
Yeah, so what I did was I gathered all of the laser fellowship-trained dermatologist offices, one of them being Dr. Kesty here in St. Pete, along with plastic surgery offices and med spas across the country, but then compared them in similar zip codes. I did telephone surveys, did a lot of online research, and asked some questions about physician involvement in laser procedures and consult fees, wait times to get a consultation, and the price of lasers. Also, a really important thing too is if a patient is getting a customized or a protocol treatment plan.
So basically this study, we wanted to get a pulse on basically the state of lasers in the United States. So Kensie and I came up with a protocol where we did this massive survey for all of the different types of offices that patients can go to get lasers to collect data on what was happening in the United States with lasers so that we could tell patients this information and other physicians and providers doing lasers to help them make better educated decisions for their health in terms of which laser provider they choose and which laser to choose.
Exactly.
So Kensie, tell me, why did we do this study? Why did you want to do this study?
Because of social media, there's so much information and videos about laser procedures. You can go on Instagram and see someone getting a CO2 laser, but it's really important to know who's actually operating that laser. A lot of, especially ablative lasers, are super invasive and patients should be in trusted hands. So it kind of sparked my interest, being in consultations with Dr. Kesty and hearing about, the treatment plan. But just seeing it on social media and wondering what other providers are operating these types of devices.
So you've worked with us for over 2 years now. Because we are the only laser fellowship trained people in West Florida, we see a lot of complications from the whole gamut of med spas, plastic surgeons, even other dermatologists. Did that kind of affect you wanting to do something like this for this patient?
Yeah, definitely. Over the past 2 years, I've seen so many consultations where people come in with a complication and it's just sad because they thought they were in trusted hands.
Yeah, patients walk in and the provider's wearing a white coat and they tell them they can do this laser. And unfortunately, sometimes they don't have the education and the training to operate the laser safely and effectively. So one thing that came up in the data, Kensie, was if you're looking at dermatologists versus med spas versus plastic surgeons, the wait time to get into a med spa was definitely less.
Yes.
And the fees associated with lasers was significantly less. What do you think about this?
I would say seeing an Instagram ad or seeing something on Google, if you call and there's a free consultation and you can get in the same day, patients can flock to that. But there's so many other factors that go into scheduling a consultation and, seeing the right provider.
If a patient does happen to see something like that, or if a patient is looking for someone to do their lasers, based on the data from this study, what do you recommend patients do to kind of vet people that advertise that they can do lasers?
Yeah, I would recommend first doing as much research on the website that's available. You see so many med spas now that there's no information on any of the providers. They have like what devices they have and information on what they do, but they don't have any information on who's actually doing the procedures. So I would say it's super important that there's a provider on the website and they have a biography, just like Dr. Kat Kesty and Dr. Chelsea Kesty do, in a resume also.
So you can see where they went to school, if they did laser training. Would you recommend patients call their office and get more information?
I definitely recommend that because sometimes even the consultation is with a physician or a provider, but then like what we found in the research, the physician basically just tells the laser tech what laser to use. So it's not actually the physician operating the device, which is very important.
Yeah, and one thing that came out of this research, which I thought was really important for consumers to understand about lasers, is just the different levels of education that in the United States are required by law to operate lasers. So, for example, Dr. Kesty and I, the other Dr. Kesty and I have 4 years of undergrad, 4 years of medical school, 4 years of dermatology, 1 year of laser fellowship. So, that's 13 years of training, and then you look at PAs and mid-level. So they have a 2-year degree, and then sometimes they will do residencies, fellowships in either dermatology or with lasers to get a lot of training. However, we do have this third class of people operating lasers in the United States that honestly, I wasn't even really aware of until we did this research. So it's great consumer education, and that is the laser technician. So they're not physicians, they're not PAs or nurse practitioners, they're called laser technicians. And doing some research on them, it really varies by state how much education these laser technicians need. It looks like the average amount of education post either a GED or a high school setting is 3 months in the United States. So some states have a 1 month, like a 30-day training program, and some have a up to 6-month training for these laser technicians. And depending on the state, but on average, most states, you can operate any lasers that I can operate or the other Dr. Kesty can operate with as little as 30 days of training, which is definitely something to think about if you're a consumer. Is 30 days or even 3 months enough education and training to operate a laser on your face? And I think that's something that, consumers have to decide for themselves where their comfort level is. What do you think about that, Kensie?
I think that's pretty concerning. Having someone operate a laser on your face that's had training for only a month or even 3 months, because working at St. Pete's Skin and Laser under Dr. Kesty, I'm in procedures with her every day, and I can see how long it takes to truly understand. We have over 30 laser devices here, so the settings, how to operate it, different skin types, there's so much that goes into it. So I think picking the right provider that has had the training is super important. Something else in the studies is that a lot of times laser techs use protocol, which is also concerning because there's so many different skin types, and using the same settings on one person is sometimes not safe for the next person.
Yeah, for sure. That was something that really surprised me with the research that came out of the research as well, is how many people depend on a protocol, which is just completely the opposite of how we practice lasers. There's so many complexities and nuances. You have this really complex organ, the skin, and you have this really, really complex machine device, a laser. And kind of how do you understand both of those things at the same time and then bring that together safely and effectively to get patients really great results? And then you're combining different lasers, right? Most of our cases are a combination of anywhere from 2 to 6 lasers. So you're combining the skin with, 6 lasers. It's a lot. So to me, using a protocol is definitely something that was a new concept to me.
And that also shows why we've had people come in for consultations where even from non-ablative lasers, they're being scarred because these laser techs or whoever it may be are using the same settings on all of their patients. So
one of my favorite statistics from the study that Kensie and I did was that 98% of fellowship-trained laser surgeons are customizing settings for patients. So that just goes to show that it's just a really important cornerstone of our practice as laser surgeons to look at the patient in front of us, choose settings, choose lasers that are appropriate for them that day. Even that day, because patients can age over 2 years, they can get a sunburn, they can get a suntan, they can get more laxity, they can lose weight or gain weight. All of that can affect which lasers and which laser settings you're using that day. So I thought that was a great statistic that came from the paper and the work that we did together. So Kensie, you've been working with us for over 2 years. You're definitely one of our most loved staff. You have so much experience in lasers now. Being one of our medical assistants, you've seen so many cases from, super light, non-ablative lasers all the way up to, laser blepharoplasties, eye rejuvenation, very involved complex cases. What do you think is the next chapter of lasers? Where are we with innovation? What's next? What's hot?
Yeah, definitely. With innovation, AI is a big factor. Using AI to customize treatment plans for patients based on their skin type. Of course, that's something that needs more time, but I'm super excited to see that being integrated in dermatology. Also combining laser devices in one laser session as well, which Dr. Kesty already does, but it's really cool to see how different lasers just in one session can give you such great results and how much improvement in sun damage and redness you can get from one laser session. I think it's awesome.
Now, hopefully, when you're practicing lasers in a few years, all that AI will be, out there and published and fine-tuned. You'll be one of the early adopters of using AI for lasers. Obviously, what you've learned here, which is, it's not just one laser that does everything. There's so many different lasers that you need to get patients good results. I'm just super excited for you to be doing that on patients yourself in a couple of years.
Another really exciting thing is eye procedures. We have so many cases of eye rejuvenation procedures here. Dr. Chelsea Kesty does the laser blepharoplasty. She's one of the only ones in our state, even in the whole country, that does that. An eye assistant knows with her, and it's really awesome the results that you get in one treatment because you can also laser the lower eyelids at the same time and the full face. So it's just a really good treatment.
Yeah, I love it. So I think one of the major things that's going to come from this paper that Kensie and I worked on and is now published in the Journal of Cosmetic Dermatology is it's going to help influence consumers and educate them on the state of lasers in the United States and help them choose someone to do their lasers. If you're a follower of this podcast, you know that I like to do 3 things. I like to check credentials on people that do lasers, and I like to call their office and ask them what percentage of the time they do lasers. And I also like to look at their before and afters. And I will tell you that question number 2 came directly from this research. We had this research done in, early October of last year, but it wasn't published until later in 2025 because it had to go through the peer review process before publishing. But one thing that I really loved about this paper is that it showed that people who are fellowship trained in lasers and good people that have great before and afters, whether they're plastic surgeons or mid-levels, they're going to spend a high percentage of their time doing lasers. They're not just going to spend 5-10% of their time doing lasers and the rest doing surgery or injectables or anything. You really want an expert who spends a big percentage of their time doing lasers. I spend about 90% of my practice clinical time doing lasers. So obviously I'm going to have a massive caseload and, a lot of experience with patients, which is very, very important. So I integrated that specific question because it's such an easy question to ask. Most of the front desk knew, even my front desk, if you ask her, what percentage does Dr. Kesty spend lasers, she'll probably say 70 to 100%. Yeah. So you're going to get a very good estimate if you call the front desk because they're going to see the schedule and see laser, Botox surgery or whatever. So I love, love, love that question. You're going to get so much information from that. And if the front desk doesn't tell you because maybe it's a big corporate center and they're not very familiar with that particular provider that you're asking, when you go in for the consult, for sure, ask the provider. Yeah, for sure. That has to be a question in your consult. So I really love that our research influenced how I educate other people. And I just love that question that came from this research. Kensie, what do you think about that?
Yeah, I think that's a really good point for the offices where there's a fellowship-trained dermatologist in lasers. They were spending over 50% of their time doing laser procedures. So I think that's really important because if you're seeing someone for a laser procedure who spends 90% of their time doing injectables, you could choose another provider that really specializes in lasers
Sure.
and be in the best hands.
And there's so much other data similar to this that I remember learning about in medical school. Like if you're going in for orthopedic surgery on your shoulder, you want the person, the physician who only does, shoulder. You want the person that only does shoulders all day, every day to operate on your shoulder. If you're going in for, a kidney tumor, you want the person that takes out kidney tumors all day, every day, not the person that takes out kidney tumors and bladder tumors and all these other things. So the more specialized your provider is in whatever you're looking at, the better your outcome's going to be. So it's interesting that we saw that come out in our study with the lasers as well. So.
Exactly. And it is your face, and it's very important.
So one thing that came out in our survey was that a lot of medical spas have the laser technicians use the laser and operate the laser over 50% of the time. So that means if you're going into a med spa, you have an over 50% chance of having a laser tech use the laser on you. I don't think this is necessarily good or bad. I think it's just something that the consumer has to understand. Who is operating your laser? Is it a physician? Is it a dermatologist, a plastic surgeon, a PA, nurse practitioner, or a laser tech? And understanding what those different educational levels mean, and then also how much laser training has that person had. I think you can have a great laser tech that, they did 3 months of school, but then they shadowed under someone. Maybe they were an MA like Kensie was for years and years and years. They saw 5,000 laser cases, and then they went out and they built their laser practice little by little. You can get great outcomes with that person, so it's all about that initial cosmetic consult, learning about who's going to be doing your laser, what education do they have, what formal and, maybe informal training have they had that is going to help them get the best result for your laser. So I thought that was really surprising, over 50% of med spas are using laser technicians to do the lasers. Again, not good or bad, just really important for consumers to understand that a laser technician is different than a nurse practitioner PA and different than a physician. They're different education, different levels of training.
Yeah, I agree with that. And also because you're less likely to have a physician on site or a physician being involved in the case, and you're more likely to get a protocol treatment plan.
Right. Yeah. And all these are something that you can ask at that cosmetic consult. Do you guys use a protocol? Do you, is this customized? If it's customized, where is that education coming from? Is it formal education like a laser fellowship, or is it shadowing for months to years? What does that training exactly look like to get the best results? So Kensie, we did a lot of research this year. What do you think is the biggest red flag? If you're a patient walking into a provider's office, what's the biggest red flag for you?
I would say one of the biggest red flags to look out for is walking into an office or even looking at the office's website. I would say one of the biggest red flags is not having any before and afters of the results that they're getting for their patients. Sometimes they have the laser companies before and afters on their website in the office, but it's important to see what results that they're getting for their patients.
For that individual
provider. Yeah, exactly.
Well, Kensie, thank you so much for coming on and talking about your research. And thank you so much for all of your hard work. Obviously, here at the practice, we love you. And then also with this research project, I think it's really going to change how consumers look at laser providers. And this is just such great material. Please go and read our paper, look at the figures. It will definitely help you choose someone for your lasers and make the best educated decisions for you. Thank you so much, Kensie.
Yeah, and thank you, Dr. Kesty.
See you later.